Time now for this week's Health Matters. PA Lynn Szabo in the KFUG studios this morning, along with myself, Paul Critz. And what are we talking about today, Lynn?
Hepatitis C.
Why?
Titled a Norte Favorite.
Oh,
because it's super common up here.
Is there, just before we even dive into all that, because I have little to no conception of just what hepatitis entails. Why up here? Is it a poverty thing? Is it a rain thing?
Probably like a depression thing. Is that what you mean by rain?
Yeah.
Probably both of those. But it's also an age thing. It's kind of probably my generation. So I'm 64. Mm-hmm. So go plus or minus 15 years. And I think it's because we were all, I think I'm the last of the boomers.
What year were you born?
1958. It depends how you define it. So some people say 64.
Right.
But anyway, blame the boomers. So
I found with boomers, because my dad's like classic 1945 boomer, that you go back there are levels of boomers that don't acknowledge the boomerness of subsequent members of the same generation. It's like late 40s, that's boom. Mid 50s, no. But it is.
I know. I don't particularly feel like one, but oftentimes I act like one. So. I don't know.
So how is the Hep C or Hep C awareness or hepatitis awareness, how is that a generational thing?
I think a couple of things. One is that there was probably an increase in drug use and more than IV drug abuse, because it can be kind of transmitted in other ways with cottons and stuff like that.
Okay, so it was a cultural thing. Sort of. Okay. And
then probably opening up of the gay community, specifically men who have sex with men, who shouldn't be, this shouldn't be weaponized against him, but it is, we'll talk about that. That's a way that it's transmitted. And then also I think we're just at the point where we see it.
Yeah. Okay.
If you don't see it, it's not there, right?
Right.
So I think we have the capacity medically to see it now. So
okay. Yeah. So what exactly even is hepatitis?
So hepatitis is a generic word that means inflammation of the liver.
Okay.
And kind of like apples, there's a lot of different kinds, and I've said this before. So there's viral hepatitis, which include mostly A, B, and C, but there's also some kind of weird ones. There's autoimmune hepatitis. There's drug-related hepatitis. The most common one being alcohol.
Oh, wow.
And there's probably some other things that are like third world things that we don't really see around here.
So I imagine there can be, if we're just describing a condition of the liver as an inflammation or inflamed, there can be all kinds of things that cause that.
Yeah, that's a huge, wide open topic.
Okay. But
we're looking specifically at Hep C because that's liver inflammation caused by Hep C or inflammation. This was kind of interesting. It has an acute presentation. I didn't know this, and I'm wondering if I've missed it probably over my life because I've never seen it. But it only happens in about 1/3 of patients, but it's fatigue, joint pain, and jaundice. So jaundice means a yellowing of the skin. But the remainder of patients slip by with no problem.
Okay, so how do you think that maybe there was something that slipped by you? Is it just the percentage?
I've never seen it.
You've never seen the acute presentation?
No, never have.
Okay.
Not that I've recognized. So,
is it something that if you saw, you call it something else first?
A jaundice is kind of a pretty, couldn't be anything else kind of symptom.
Okay.
So if I saw somebody who was jaundice, I knew they would have hepatitis. Whether I would immediately jump to C, probably not.
Okay.
Kind of depends on the rest of the picture. So, but about 85% of the patients who get the disease go on to the chronic form. So this is a cool little factoid. And so about 15% of people who get the disease, their body's able to fight it off.
Wow.
And although they have positive testing, they kind of have the footprint of the virus. They don't actually have the virus in their system anymore, causing any kind of pathological role.
Okay.
So that's super cool. But I have seen that. Liver cancer is also a possibility, and also cirrhosis and liver failure, unpleasant way to die.
Can I ask a timeline question here with this? Just reading through what you're reading. So it says, so you've got 15% of the people with Hep C can deal with it. 85.
Yeah, they don't really get it. They kind of like fight it off.
They've been exposed to it, but it doesn't do anything then, right?
They get the acute syndrome, and then they fight it off and they're well.
Gotcha. Okay. So then I guess what I'm saying is about, then you've got, where did I read this? The remainder of patients have no symptoms. Can those patients who have no symptoms, regardless of the third who do, can they slip into the chronic stages sort of unaware that they even have?
That's exactly what happens.
Wow. Okay.
Yeah, hence the problem. And there's a lot of different kinds of hepatitis C. So there's 8 major genotypes, so 8 major kinds, okay? And then that's divided into about 60 subtypes. And if you look at where the different genotypes and subtypes are in the world, there's definitely, ones where there's a predominance in Asia or around the Mediterranean. And, or in the United States, although we're a little bit more mixed up, but not completely mixed up. There's kind of preferences for genotypes here. And the reason that's important is because the genotype defines the treatment.
Okay. And I imagine the genotype that comes to prevalence in a locale does so because of sort of the lifestyle of that locale, like how easily that kind of disease is passed between people?
Yeah.
Okay.
Yeah, so it just kind of hunkers down and becomes, I guess, our particular genotype.
Wow, okay.
So although people travel too, and especially, the Vietnam War, a lot of people got, with the heroin use and stuff, a lot of people actually came back to the United States not knowing they had Hep C. And so we see a lot of, in that age group of young men who were drafted and over there, we see a lot of hepatitis C with that particular genotype. So it kind of depends on a life. So about 58 million people in the world have hepatitis C. That's like a lot. That's a lot more than I would have guessed. And prevalence, of course, is so way common in incarcerated people or institutionalized people, men who have sex with men, and then IV drug abuse, which is kind of a big risk factor.
So transmission of hepatitis C, first off, a couple of questions. Prevalence of Hep C compared to A and B? More Hep C?
I think there's a lot more, yeah.
Because it's more easily spread?
I think it's because it's because there was a period in time where it was more easily spread. Now I think there's more understanding about it, so I'm not certain that door is still open, although it might be for some people. I've
seen it, and Hep C is mentioned like in the list of STIs and things to protect, but it's always like last.
Right, it's because it's a pretty low transmission rate. Okay, but like all things sexual, it kind of depends on what the behavior is. Okay. So it can transmit. I don't want to focus on the men who have sex with men because it is transmittable between men and women too. Probably women and women, although probably less so. It depends what's happening, really. You have to get down to brass tacks, that's better left to the exam room.
So are just about the questions about the transmission, is it like HIV? Is it a body fluids thing? Is that what we're looking at?
It's percutaneous, so it's blood.
Okay.
Blood.
Okay.
So commonly people are co-infected, and that's super common up here because the same behaviors that can transmit hepatitis C also transmit HIV.
Gotcha. Right.
So,
okay.
Yeah. So other ways of transmission can happen at birth. So if a pregnant mom has hepatitis C, then she can transmit it during birth to her or during nursing, during her child. It can be transmitted by toothbrushes, razors, or nail clippers. So I get a lot of questions about razors. People share razors. Apparently, they probably shouldn't, and they shouldn't transmit shared toothbrushes.
That's kind of,
I mean,
I don't mean to laugh at that, but yeah, that's the sort of...
Listen to what your mom told you now and don't do it. So, but it's not super common, but it's also a risk, so don't do it. And then, of course, don't share drug paraphernalia. Been talking about that for a long time. Tattoos are another big deal. Jailhouse tattoos, non-professional tattoos, or it would be hard to believe somebody could be professionally licensed to do tattoos and not sterilize their equipment.
Right.
Because they do make a big deal about opening, a sterile packet and stuff. So, make sure if you're getting a tattoo, it's done professionally with correctly sterilized needles.
My daughter has a story about getting a tattoo basically in the back of a bodega in New York City. And this is really bringing that story back up. and it was like the tattoo artist was like renowned all over the city. It was a place you went, but it was a bodega someplace in like uptown. Right. And I'm like, oh my God.
It sounds like my kid. My kid my oldest daughter in LA has a lot of tattoos all over. And I say, were these sterilized needles? And then she answers the question with things like, well, it was a woman tattoo artist, Mom.
Oh, that's not.
Do you think that's going to turn me off?
You're not so easily distracted
child,
from
you don't know me. So.
Oh my God. Okay.
So it is not, we will all be happy to hear, not spread by mosquitoes by sharing utensils, coughing, or sneezing.
I've never even, so yeah, your spuma, that's not you're not spreading it that way, but.
No, it's not the humors.
So other than like, the humors, that's good. I'm feeling bilious today, doctor. Green bilious to be exact. Is there anything that is spread? I mean, besides the obvious one, because the mosquito thing always comes up because it's blood and sharing blood and everything, but mosquitoes don't work that way. Is there anything besides malaria and I don't know, dengue or whatever they get? Any of the diseases
all that stuff.
Ooh, I've never heard of that one. What's that one?
That's kind of like dengue. It's a viral illness in the Caribbean that's passed by
in
mosquitoes.
The Caribbean.
Typhoid, yellow fever. And mosquitoes.
I didn't know the Caribbean.
Turf.
I didn't know the Caribbean had chimed in with their own. I thought it was all old school out of Africa
when
stuff.
When I was in school, I went to school on the East Coast, and it was like a lifeless diagnosis to diagnose dengue fever.
Oh wow!
And we saw it occasionally, but not often enough to be anything but totally impressed with it. And it's a horrible disease. People are really feeling awful. I have seen
right.
it.
Okay. So Hep C, you can't.
Hep C, not.
Are there other human bloodborne pathogens that can be spread other than the obvious ones?
By what?
By mosquitoes. Sorry.
We just nailed a bunch of them.
Yeah. But not the ones that people at least here walk around worried about. Yeah. Okay.
No. I think we're going to have to worry more about ticks someday. But yeah. You. So, why is it important?
I already worry about ticks. I don't like that. Okay, go ahead. I'm sorry. I spend a lot of time outside. I'm always worried about ticks. Am I going to do this more?
No, you just have to be a little vigilant after you come back home.
Yeah.
So anyone over the age of 18 should get Hep C tested at least once in their life, and maybe once more as they age. Okay. So I think the second recommendation is kind of targeted at a specific generation, but I don't think I would, women as they go through pregnancies definitely get routinely tested, but I don't think very many men get routinely tested. So when guys go in and they want STD testing, they what that means to them is they're okay with peeing in a cup, but they're not having any exams, which is fine, and they're not having any Q-tips in invasive places, which is fine. We've all beyond that, but they don't want any blood tests, and so
how in the world
almost none of them get tests for HIV.
Really,
or Hep C,
guys go in to get STI tests, and
they think it's just peeing in the cup, and if you broaden their horizon, it's still peeing in the cup to them. So part of the problem is hepatitis C testing is not really paid for by the same grant money in California that pays for like gonorrhea, chlamydia, trick, all that kind of stuff. So I would.
So that just gets dropped. It just forgotten, eliminated. Then at the end of the process, wow.
Women have more opportunities and follow through with more opportunities, but men are like, no, I'm not going to think about that. It's not real then.
Yeah.
So you guys go in there and say, but what about my Hep C testing? What about my HIV testing? And, blood draw is not a big deal.
No.
So you can do that.
And they can answer so many questions. In fact, just going in for like a checkup, most of the work is the blood draw, right? You have a conversation and you talk about what you're experiencing, but really most of their insight is going to come from the blood draw. So,
and if And don't ever come out of it and tell your partner that you were quote unquote tested for everything if you didn't have a blood draw.
Wow.
Because you weren't. And she's smart enough to know that.
Guys, that's just dumb.
Yeah, guys, come on.
Yeah, wow.
So you could come to Teen Clinic and I'll set you right. So so why should you even get tested? Because what if you feel okay for 50 years, takes 50 years to develop liver cancer? You know. Who knows? Because there are treatments. This is the big thing that's changed in my career.
Okay.
So I got a little historical viewpoint on this. So when I first started, I was working in the Castro in a practice with gay men with AIDS, most of them. And hepatitis C didn't even have that name yet. It was called at that time it was called non-A, non-B. Wasn't even called hepatitis.
It's just
non-A, non-B.
Huh.
We could see its footprint on the blood tests. And we were like, meh, it got a little non-A, non-B, I guess. It was super common in people who were HIV positive, super common in the gay community. And people were actually dying of hepatitis, and we didn't really pick up on that.
Wow. Just lost in the shuffle in the HIV and the and AIDS
part
development.
Part of it was being
things?
overwhelmed with the struggle against a different virus, but part of it was it didn't even have a name.
Wow. Man.
So then it got this name, hepatitis C, and then all of a sudden there's this like huge renaissance with both hepatitis C and chronic hepatitis B, where they could test. They could do viral load testing, which is a super elegant testing mechanism that we got from the HIV fight, where you could see actually how much virus was in a unit of blood.
That's interesting. And yeah, that's the first time I ever heard viral load was with the HIV stuff. Yeah.
So super simple. And the best discoveries in medicine oftentimes blew up the whole viral world.
Wow.
Yeah. And so that gave people a way to monitor who was in trouble, who was at highest risk, who would benefit most from, at that time, the beginning treatments were kind of difficult on people, and there were pluses and minuses. What the time for treatment would be, like maybe somebody's still okay, come back in a year, we'll recheck it. And there was just like a huge renaissance. And since then, the treatment modalities have been refined. And I expect something like this will happen with COVID, too. Maybe not this exact mechanism, but we'll have some kind of paradigm shift.
You can kind of see, I love the going off like this, but you can kind of see like that developing. I mean, first off, when you're talking about all of this and I'm thinking about the evolution of treatments and the modalities that you describe, I think that mRNA vaccines come out of all of that, as well as, talking like we do about like looking at COVID as not a respiratory infection so much as it is a body inflammation disease. That sort of refinement, that kind of resolution that we're able to put on a particular disease nowadays. Yeah.
So consider, if you can say HIV has an upside, a lot of really remarkable medical understandings happened because of that. And a lot of the medications, at least initially for chronic Hep B, were similar to HIV-related drugs. So the treatment that we have now is not as arduous as it was before. It's super reasonable to accomplish. And this is the cool thing. It's available at Del Norte Community Health Center and United Indian Health Services. Wow. So available in this community, probably also in the private practices. It's no longer, we used to take our smartest guy and put him in a room with a medical library and make him do all of it.
Do all of what?
All of the treatment for hepatitis C and chronic Hep B. Because it was too complicated for the average family practice PA to do.
Oh wow! Okay.
And then
is it back in the days of like the medical, like the cocktails and things that were like AZT and before then?
I'm talking about like the mid 90s and just after Y2K. And then the guy came out of the room and said, "Why am I taking care of all these people? This is not that hard. Here, you guys go to a conference and learn how to do it." And, we all went, "Oh, okay." And so There are still people that are better at it than other people, like anybody in medicine. People have interests in maybe things that are not so interesting, but there is super competent care here available easily.
Wow, wonderful.
Yeah, which is effective.
Okay.
Yeah.
So a person, I mean, well, we'll get to the end here. I just have questions just about living with Hep C, how possible that is, and I guess it depends person to person, and then are you ever cured, or is it a matter of just treatment and management?
I don't think there's no 100% guarantees of cure often in medicine, even though they probably exist, but everybody is a little cautious about saying cured. But I think there's a lot of people who can live just fine because they have no idea they have it. It's not really bothering them until there's some, cataclysmic event.
Right, like liver cancer. Yeah.
But after somebody's treated, I think that it turns into going to the office once a year, get a certain, get a viral load, get a couple of liver markers, and call it good for a year if the results are good. So I think it becomes a much less terrifying killer. Right. And there, it's unfortunate too, Hep C, that it might be a reasonable time to bring this up, although I hadn't planned on it. But there's a lot of people co-infected with HIV. Also, a lot of people who are who have mental illness and drug use. And what they initially, for the treatment of Hep C, they initially insisted that people be sober for a year and that any mental illness they had be under control.
And we talked about that before, and that is
super
changing.
Unfair, right? I think.
And that is changing. There's much more of a stress of putting the actual relief of a physical reality to the fore.
And I will say here that nobody is going to insist that you not drink alcohol for a year or something before you begin treatment. They might talk to you about why that's important, but nobody is going to make it an absolute requirement. I suppose you could even be like living in the swamp, and if you were in touch with the right providers at Del Norte Community Health Center, that you could still get excellent care. So you could have few resources and still do fine.
So you bring up the swamp and the interface with the folks who live in the swamp around here in our part of town, the homeless population. The interface being the every 2 weeks, what do they call that? I guess we call it the biweekly.
Today it's going to start at noon.
The biweekly walk-up clinics behind just right up the road here. I imagine you don't have in the tackle boxes full of medications that you showed me that day I went out there. It's like you probably don't have the treatment you need for Hep C right there.
No,
right?
because it needs a certain amount of blood testing and stuff like that.
Yeah, you just don't go.
There's not like just one nerdy provider who's good at it. There's like 3 or 4 that are good at it. So, but you could start it there. Dr. Turner is there today, and he could definitely start a workup, order the blood tests. If somebody could get in, ride into town, get their blood drawn, and then meet with him, I don't think it would be impossible.
Right.
So
that's remarkable. That's just the thought of that. All the things we talk about and how judgment and money come into healthcare and just kind of foul everything up when they do.
Completely.
And the fact that even just right here, the reality is just right up the street here, there is care available today, this afternoon, to the most desperate of us, the folks living in the bushes and the swamp all around.
If you know what to ask for. So hence we're talking about it today. I mean, a lot of people, like when I work at Teen Clinic and I talk about STIs, and they'll say, well, I don't have any symptoms. Well, that's kind of the most common symptom.
Yeah, right. That's one thing.
Yeah.
So, like herpes, okay? So herpes was like, you see those movies in high school and you think, oh my God, I'm going to get herpes and something's going to fall off and it's going to be bad, right? And then the reality is like 80% of people with herpes don't experience anything at all.
They have no
don't
idea
even know.
They have it.
Just walking around spreading it.
Right.
Yeah.
And let me tell you, I heard plenty of young men that I had to tell had HIV said, why couldn't it be herpes?
Oh, wow.
Yeah, I can live
that
with
would
herpes.
Be,
So, herpes is more, people perceive it as a stain on the soul. But we can talk about that another day.
And it's a stain on the soul when, in fact, we're all crawling with it all the time.
Right. It doesn't care whether you're a good person or a bad person. It cares about having its immediate needs met, like warm, protected food, that kind of stuff.
You can't blame it for that.
But it is important if you have Hep C to, give your liver a break. And so it's always recommended right off the bat that you get hepatitis A and B immunization. So this brings up the point, is there a vaccine for Hep C? The answer is no, but I'm wondering probably because there's so many genotypes,
right.
But I'm wondering with the messenger RNA technology, could this be part of our future paradigm?
Right. If there's something common to all the genotypes that can be attacked through a vaccine.
So it's also important to maintain a healthy weight and to avoid liver comorbidities. And what that means is things like fatty liver, which is increase in weight in somebody. The fat has to be deposited somewhere. It's deposited in the liver. The liver is an encapsulated organ, which means it's like fenced in. So
really?
Isn't it cool?
I didn't know that.
It's got a finite space that it can occupy. And if there's fat being stored there to a certain extent, then you're not going to have functional hepatocytes, which are liver cells.
Wow, okay.
Yes, okay. And they can't do their job and they get inflamed. Another example of non-viral hepatitis.
Okay.
Yeah, really super common here. So get immunized for Hep A and B. Try and maintain a good weight. Try and stay away from drugs and alcohol.
Anything like a marker, anything you should look for specifically? You list like fatigue, joint pain, jaundice. I mean, jaundice, I guess, would be the one to watch out for.
I think a lot of chronic pain people have, their chronic pain is actually at least partially from their hepatitis C. It makes people, when it's chronic and it's, kind of driving along there, it makes people feel like their muscles are achy constantly. And that's something that's kind of overlooked.
Just kind of like all over body achy sort of thing? Okay.
So if somebody comes in an exam room and says, look, I have pain, and the provider says, like, where? Thinking they're going to say my ankle or my wrist.
And they go,
and they say my whole body. That sounds like hoping to get Vicodin. But that's not,
oh, no.
That is not necessarily the case.
Right,
okay,
right.
But so a provider will kind of glaze over and maybe take the conversation in a different direction that's like wrong. So.
And I have, there's lots of anecdotal experience, not personally here, but I know lots of folks who have been, who have left the exam room really, really upset because they'd been accused of drug seeking when it was a chronic condition in this person. This is a thing. And even sometimes a new provider doesn't maybe know their history personally right off in there.
Or doesn't think to say, what do you mean by that?
Yeah.
Because you can find out a lot when you kind of dig down a little bit below the surface.
Wow.
So, anyway,
so there it is, wrapping up the Hep C.
What's the
takeaway? What's the takeaway for the Hep C?
Is get tested because it's worth it.
Right.
Okay.
Yeah.
And if you know you have risk factors in your life, try to mitigate them as much as you can, because this is not a super great disease, and not all Hep C is treatable. Actually,
yeah.
And it used to be kind of when we were in the punitive model of medicine, you couldn't get things like a liver transplant if you had Hep C, because that would be quote unquote throwing away a good liver.
Right. You're not worthy.
They're not so much like that anymore.
Wow.
So, I'm wondering if you can. This is just, I guess, filling time. But could you get a super infection of Hep C? Like, could you get 2 different genotypes? I don't know. That's an interesting question. You can with HIV.
Wow. Oh, my God.
But I digress. So,
speaking of digression, so this afternoon you're not heading up the street? You don't have to go do your time?
I am not, but I understand there's going to be a little barbecue scene going on, and Dr. Turner's going to be there, and, they've restocked their medicine chest. And, all of the tools that he needs to do the best medicine that he can there. Yeah. So I'm kind of excited that he's there, although I wouldn't mind working there if they wanted 2 providers there. Because as a physician, and he does work at the prison, but as a physician, that extra knowledge is going to be super helpful, because he probably treats a lot of people with Hep C, and probably HIV, and probably chronic hepatitis B.
I know that Mission Possible is out there with Open Door as well, and Daphne sends the college student who works for her out there to make food. So maybe, I don't know if he'll be barbecuing today.
I know.
But I know they hand out a lot of things like socks and blanket or tarps and things like that. And we just had our first kind of all night rain of the year this week. So I'm wondering if they have not an exaggerated but a heightened need for those items in the days and weeks ahead.
Definitely, always a need for dry socks.
Check them out online on Facebook here locally in Delaware County. Mission Possible. Daphne Cortez Lambert does a lot of really good things for people, not just her, but her people working for her too.
Yeah, they're super excited too with taking that model on the road. And once they get their actual, they called it a van. It's more like a blood bank bus.
Yeah, the Open Door. That's like being built to custom specs and things. That's that'll be really useful. And taking it on the road, like where all over the county. Then,
yeah. Right? So like pop-up, like the pop-up restaurant idea in Humboldt County, pop-up pop-up clinic
in the Glen and all over, right? Yeah. Wow. And then later tonight, I know we'll both be down at. We're just throwing in local news now. Down at the Point of Honor here in town, which I had no idea there was even a Hmong memorial there.
I had no idea either.
Nobody's ever made a deal out of that. Somebody knew about it and defaced it this week. And there's a kind of a get-together, what would you call it? I wouldn't call it a vigil. Would you call it a vigil? It's just sort of a...
She calls it a vigil.
She calls everything a vigil.
Because she's organized. Who's the organizer? Should we say her name?
Denise. Yeah. Denise Schnacker, and also...
the angel among us.
And KFUG board member. That's why we locked her down as soon as we could, because, she organizes very, very well. But a vigil, you can bring candles, flashlights, whatever. It's at 5:30 this evening, which is not going to be dark, but still we're going to get down there and do video of it as well and just highlight the fact.
Do you know what happened to the
it was
monument?
There was some sort of like a diamond. If you look at the pictures on the Wild Rivers Outpost, the Jessica wrote, there's some sort of like a rock sort of thing that was on like a pedestal, like a plinth, and it was pushed off and like broken off. And so I don't know. And that's why they're hoping to get it repaired by Veterans Day, but that's going to take more to do that because it's actually broken. It's stone that's been broken. So I'm not sure what's out there now, how they've left it, or if it's just been taken away and it's just the broken. But there'll be a lot of people out there today showing support and saying, whoever did this, you're a jerk.
Part of our community that's not often on the radar. And according to Denise, in the last 2 years, they've been getting like way more abusive treatment.
Really?
Yeah. And this is kind of like the last straw. And Denise is in action, but they don't need her to save them either.
No.
I'm not implying that.
No, that's not it.
But she's working with them to increase our understanding of how we can move forward in a better way.
First thing is that if you walk around and you're an American, and I'm assuming you're a white American, and you're walking around and you're getting all racial about, these folks fought for us when nobody else, and where nobody else was.
Right.
And is what you say about what the secret war and all of Southeast Asia in the 20th century, all of that stuff, it was just horrible, yes, and wrong. And and I don't think we should have been there, but we were. And these people were there for us. And it was actually the reason we have so many Hmong in the United States is because afterwards it was kind of rank and file CIA people who'd worked there for Air America and doing the things in Laos and Cambodia that really stepped up and lobbied to have kind of mass evacuation of these people who'd been our allies in the hills of Cambodia and Laos. And that's why, and a lot of them came to most of them I think came to California, and the Valley is a big Hmong community, and we even have Hmong community up here. And anybody who comes at them with that xenophobic jingoist, go back where you belong, so it doesn't understand history, and 2, just what it means to be an American. And it is the worst possible. I just, I kind of get upset about that. Yeah. And clap the loudest, I think, in the 4th of July parade for the Hmong people walking down, because they really fought and are here. And I think value that more than perhaps the people who went and defaced the monument.
Let me say in the exam room, the wounds, the scarring and stuff is horrific on kind of the older male population, horrific. And they'll come in and they'll say, well, my stomach kind of hurts. And I'll go, let me do an exam. And I'm like, oh my God, what happened to you? Were you going to mention this?
Yeah.
So we owe them a lot.
Mm-hmm. Mm-hmm.
Yeah.
Yeah. Anyway, so That's why we'll be out there this afternoon. So if you hear this on Sunday, it will air today. This will air today. It's at the Point of Honor in Crescent City, right there at the S-Curve this evening at 5:30, right?
Yep.
Okay. And thank you, Denise, for putting all this together and reminding everybody that we can be, up here in Delaware County, we can be good people, too.
Yeah.
Right?
It's not even that hard, folks.
Yeah.
So...
All right. Well, Lynn Szabo, thank you so very much for being a good person and coming in and talking to us today about Hep C. Any idea for next week?
I'm still trying to get Walmart Mike here
right.
in his generic pharmacist worldview on what's happening in rural pharmacies. They're having a meltdown right now in Humboldt County that looked just like what happened to us here about 2 months ago. So we'll see what he has to say about it.
It's always an interesting conversation with you and Mike too. I like that. I kind of want to secretly start recording before we go live because you guys just have the skinny on everything healthcare wise in Delaware County. It's very, very cool to listen to. But alas, poor listener, you will not hear that. You'll hear the sanitized,
politically correct version.
Lynn Szabo, PA. Thank you so very much for this week's Health Matters, and we'll see you again next week.
Thanks. Bye.